we're going to learn about a collaboration of age-friendly communities in the DC metro region, and we got some really exciting and dynamic panel members who can share with us about this movement, and they can encourage you to get your community involved in this age-friendly movement, and if you're an organization out there, how you can partner with these innovative communities. So since I feel like I'm babbling now, I want these panel members to come on board, and I can drop back into the behind the curtain. So welcome, and I'm super excited on this concept. I will I think I'm gonna turn things over to Gail Cohn and let her introduce the rest of our panel. But I will say, those of you who know Gail, so I've been doing this for 32 years, and I met Gail, and she was a leader in what was a new movement, the continuing care retirement communities, and she's this pioneer in that area. And then she leaves that, and you're sort of like, wow, how could somebody leave such a great career? She's one of the thought leaders in the retirement community space. And then she jumps into the villages and again inserts herself as a leader there and as a pioneer. And then she sort of exits stage left a little bit there, and then she pops up in this age-friendly movement. It's like, Gail, you have really have quite an impressive career, and I'm excited that you're a part of this age-friendly movement. And whatever Gail asked me to do, I do it. And we had a discussion, and I was like, Gail, we got to add some fuel to this fire. I want to do this age-friendly as one of our discussions here. So I'm babbling. I got to drop behind the curtain. I'm going to turn it over to you, and you guys let it rip. And again, remind our audience that we want to make this engaging. So ask questions and take it away, Gail.
Steve, you are so kind. And I remember you when your hair was dark.
Yes.
And you remember me when my hair was blonde. So, we're in different places, but it doesn't matter. It's been a fun ride all the way through, both for you, and you've had a very interesting career too. And those of you who are on this program with us are in for a treat. The World Health Organization presented us with a real opportunity. I will tell you that the World Health Organization said, gosh, the population is changing. You cities need to be ready for the future with many, many more older people, and with a population that is moving more and more to urban environments. That has changed over time, so that we now have rural jurisdictions that have submitted their letters of intent to the mayor, from the mayor to not the World Health Organization, as much as the jurisdictional leaders that have been named through time. And AARP is the jurisdictional leader for the United States. There are jurisdictional leaders for Latin America, for the Middle East. I can go on, but you can imagine how many jurisdictions have found this to be a very interesting initiative, because it follows the social determinants of health. How can we change what our cities and our communities look like to make them easier places, and this is coming from the World Health Organization, to grow older, not to make it better necessarily for those who are older now, but to make it better for people as they grow older, which indeed in the process makes it better for people who are older now. So what you're doing wherever you are in the space you are playing a role in making the jurisdiction you're in an age-friendly jurisdiction by engaging with and encouraging people of all ages to face and look at how they are aging and how they work with people who are older. Melissa Batchelor is a colleague in the academic space. You'll hear later from Pamela Saunders, who's also in the academic space at Georgetown. Melissa will be our next speaker, but I want to tell you that there are jurisdictions all around the region, and we got together because we have common issues that have been brought forward by the people who live in our jurisdictions that we all share. And we'll talk about that as we go forward. Melissa?
Yeah, so I appreciate you having us here today, Steve. I started at George Washington University at the Center for Aging, Health, and Humanities about 3 years ago, and that's when I met Gail. And one thing I've learned about Gail is Gail can tell a lot of people to do things and they do them. And so she told me that we should have a regional event with the other age-friendly cities. And I thought, all right, well, you know everyone, I'm new here. So together, we have partnered with not only age-friendly DC, but Alexandria, Arlington, Hyattsville, and Montgomery County. And in May of this year, we hosted our first age-friendly ecosystem summit, which was really the first time that we were able to, through some podcasts, interview some national and international leaders in the age-friendly space. And then we had a 2-day event locally where we had, on the first day, we had regional leaders, which thanks to Gail's network, we had a lot of different really great speakers. And then on the second day, each of the age-friendly municipalities that's here with us today, they shared their best practices. And so we felt like that was a really great way to create a platform to just educate people about what all the age-friendly initiatives are, because there's not just age-friendly cities and communities, there's age-friendly public health, age-friendly universities, age-friendly businesses, age-friendly employers, age-friendly, I forget, I think there's another one, but there's a lot. Public health, yes. And so, and really even when I started at the center, I didn't even know there was that much going on in the age-friendly space. So what we have done now is we've pivoted to an event that's coming up in October 27th, which I put the link in the chat for anyone to register that's interested in joining us. And this one is funded by AARP and through AARP DC, and we're calling this one this Age-Friendly Social Innovation Challenge. And what we're wanting people to do is come together and develop moonshot ideas for solving all the different problems that we have across the region related to age-friendly domains like housing, transportation, civic engagement. And then in the afternoon, that's the public event that I put the link in for. We're going to share what those ideas were and what they are to really just to begin to help people dialogue. And then at some point this afternoon, we want to share even just some of the outcomes that we've seen from just getting together and sharing ideas, how it's really improving the lives of all of us, because that's one thing we're all doing, we're all aging. Because programs in one city are being replicated in another. So I will let Pam talk now, and then we can come back to all of our outcomes after that.
Thank you so much, Melissa. I have to echo what everybody else has said. Wherever Gail goes, I will follow. Gail is part of my faculty at Georgetown in the Aging and Health program. We teach a class together in the summer on age-friendly and aging in place. And I've had the pleasure of working with Melissa, I think almost when she started at GW. And it's been a really wonderful, productive relationship. So Steve, are you able to put up the slides that I sent?
Yes, I am. And I'm sure everybody saw the lovely message in chat. Fortunately, we're all adults here, so we've seen those words before, but that's a first for our discussions. We're usually not attracting Zoom bombers, but I've done everything that I can to make sure that that person doesn't jump back in. Unfortunately, I can't erase the captioning. So Pam, just tell me when you want me to advance the slides.
All right, thank you so much. I'm lucky that we're lucky that it was as little impact as it was. So thank you for taking care of that, Steve. So just by way of introduction, I'm Pam Saunders. I'm the director of the Aging and Health Program at Georgetown University. I'm just going to give you a quick peek at what age-friendly university partnerships with the community looks like. So just overview, I'm going to talk about the Age-Friendly University Global Network, which should be a good resource for all of you. Then the age-based university retirement communities, if you're not aware of those, and then tell you a little bit about our program, and then how we are partnering with Melissa at GW. So the Age-Friendly University Global Network, AFU, you can see the link at the bottom of those slides. And Steve, I'm happy if you want to share these with people. This is something that was started in Europe in combination with a number of organizations across the world who really wanted to think about how institutes of higher education could be age-friendly, both in practice and physical space, and reaching out to older adults who might live close or far to be a resource in terms of lifelong learning, intergenerational experiences. So just go to the next slide for me. They have 10 principles. Currently, Melissa and I are hoping to collaborate on convincing Georgetown and GW to become age-friendly. So we're starting to talk about that. I have a group of undergrads who are going to do a little research for me this fall to see where Georgetown needs to up their game. But you can see by these principles that it's everything from encouraging participation of older adults in core activities to encouraging educational programming for older adults, but also about aging, promoting intergenerational learning. Just go one slide, Steve. So if you can all read those at your leisure at that link. Next slide. This is just a very short list that goes way down past the bottom of the slide of the current universities who are age-friendly approved. And so you can look at that. The other thing I wanted to talk to you about was university-based retirement communities. So this is the idea that a university will have a retirement community either on campus or very close to campus for a really close partnership. And our faculty member, Andy Carl, who was the executive at a community out in Virginia, at the Virginian, it was really one of the first promoters of this idea. And so I'm borrowing some of these slides from him. Originally, the first ones were at Indiana and Iowa State, and those have been going since the 80s. So next slide. The characteristic of a university-based retirement community is it should be close to the university. There shall be formalized programming. So everybody agrees that it's an important partnership in writing. That there should be a full continuum of services. So people who live in either assisted living or independent living or memory care should have access to all of the university services. There also should be a financial relationship. And then ideally you'd have a 10% of the occupancy of the senior living community might be alumni, staff, or faculty. So this is kind of a formalized relationship that, hey, wouldn't it be great? The benefits, as you can imagine, lifelong learning, auditing classes, guest lectures, visual performing arts, all the wonderful things that go on in universities, and then internships, employment, and such wonderful mentoring opportunities for older adults as well as for students. Next slide. Just a little bit about the master's program in aging and health at Georgetown. We're about 4 years old. Next slide. What is aging and health? The study of people in culture and society, locally and globally, as they age, focusing on health, wellness, quality of life, economics, and public policy. Next slide. we have 2 degree programs. One is a master's degree for 30 credits, and one is a graduate certificate specifically in senior living and administration, which is 15 credits. That's led by Professor Andy Carl, who is an expert in that. So really that's the end of my, oh, no, not the end. One of the most important thing here is that we are partnering with Melissa Batchelor, Dr. Batchelor at the Center for Aging, Health and Humanities. So part of the partnership I see is that across universities, and certainly we're partnering locally to promote age-friendly at the university level and at the community level. And I know both of us would like to be resources for communities such as age-friendly. Oh, and then that last slide you can ignore. So courses if you wanted to take courses. So I will turn it back to you, Steve.
All right. Okay, so let's see. Gail, what's the, would we like to have our other panel members join us now and talk about what they're doing?
Yes, let's do that. And I will tell you that we started at different times. And I think it's useful for you to hear from Marcia Pruzan, who is in Montgomery County. You're going to hear from Marcy Lefevre, who is in Hyattsville. You're going to hear from Helen King, who is in Arlington. All of us are involved in age-friendly activities. There are other jurisdictions not represented today. Alexandria is also an age-friendly jurisdiction, and there's noise you'll hear in Prince George's County about becoming an age-friendly jurisdiction. There's noise in Fairfax County. So there are going to be other age-friendly jurisdictions coming along. Marcia, you want to tell us about Montgomery County?
Yes, hello, and hello to everybody listening and watching. Montgomery County, I always say, has been age-friendly for many, many decades, long before there was an official age-friendly program. We enrolled in the AARP age-friendly effort in 2015, and we work with a variety of partners and local organizations and government staff all over the county. I think we have 10 areas that we work in. I know many of them are, many of the groups have different numbers. We have 10, that's the way we do, and I'll just quickly tell you what they are, and then I'll just tell you about 2 kind of interesting programs we run. They are civic and social involvement, communications and outreach, which is kind of over everything, elder abuse prevention, employment, health and wellness, home and community-based services, housing, planning open spaces and community buildings, senior public safety, and transportation and mobility. So I know there are a lot of people that want to talk to you about their programs. I'll tell you about 2 that we highlighted in the summit that we had this past spring. One is on housing. Housing is a very big problem around the region, and certainly in Montgomery County, where it's expensive. And our goal in our housing group is to retain the affordable, accessible housing that we have, and to expand on that as much as possible. Our population, like everywhere, our older population is rising rapidly, and we need to be planning not just for today, but of course for time to come. So one of the interesting programs we have is a home sharing program, which we've done in partnership with the Housing Initiative Partnership. And these are just places where people who have room in their homes, either a room or a basement home or something like that, can provide safe housing for people who are seeking a place to live. So there's a whole process set up to find compatible housemates, to put matches together, make sure they're safe and comfortable, and everything to help people who maybe aren't familiar with the online process of how to apply. The Housing Partnership will help you do that and guide you through the process and counsel you on any issues you have. I mean, right now, as you can imagine, COVID is a big issue for having other people come into your home. So they are working very hard to alleviate that problem. Our second problem that project that we talked about at the summit was elder abuse prevention. And I was startled to learn that between 2 and 5 million older Americans experience elder abuse, and that can be neglect, financial, sexual, physical, any kind of abuse you can think of. And it can be by family members, caretakers, or people who are financially responsible for helping someone, and in any setting. So with the rapid growth of the older population in our county, we created a seniors vulnerable a unit in our county called Seniors and Vulnerable Adults from the state's attorney's office. And they do a lot of outreach and education about how to educate people, how to know what elder abuse is, to look for what we call red flag evidence that there might be elder abuse, what to do when you suspect it. And this is, again, a big partnership and collaboration with the county state's attorney's office, the police department, fire and rescue, health and human services, and the office of the county attorney. And then when problems are referenced to us or to this unit, they actively investigate and prosecute these crimes. They were, I mean, just two quick examples were one of these woodchuck scams where strangers come and tell you you need to have very expensive work done on your property that isn't necessary. And we had another one that was successfully prosecuted of a caregiver who actually stole cash and jewelry from someone they were taking care of. So those were just some examples. So I think I'll let some others now talk about their programs. Thank you.
Great. This is great. And you know, one of the important things is that if you're on this call and one of the jurisdictions that you live in or you operate in is not age friendly, this is a great opportunity to make some connections and help make this happen in your region. Let's see, who wants to go next?
Well, let's call on Marcy. Marcy Lefevre, who's in Hyattsville. A wonderful community in Maryland. We're still in Maryland, and we're going to stay in Maryland, and then we'll move on to Virginia, and then I'll tell you about the District of Columbia. So Marcy.
Great, and I've got a slide deck for Marcy.
Hey, good afternoon. It's a pleasure to be here with you today. And on behalf of the City of Hyattsville, our city's age-friendly work group, and my city colleagues, I want to thank you all for this opportunity to participate in this Building a Regional Age-Friendly Community Network. My name is Marcy Lefevre, and I'm the Age-Friendly Program Lead for Hyattsville, Maryland. And I thought I would take just a moment to provide a brief snapshot of our great city. We were founded in 1886, and we have a population of about 18,250 residents. Our city's mission is to build and support community by striving to meet the needs of our residents. And as COVID taught us very well, the needs of community members can change on the dime. And the ability to pivot and be able to identify and meet those needs is a great task that I think all of our age-friendly programs have really strived to do this past year and a half. Our city's mission is, again, to meet the needs of community, but we carry this out through youth and teen programs, services and programs for older adults and persons with disabilities, volunteer opportunities, of which many of our older adults are some of our most engaged volunteers, communications and community outreach, cable channel programming, and community-driven events that celebrate our community's diversity. I'd love to speak to just some of the specific programs and services that we make available for our older adults and persons with disabilities in our community. We have Ageless Grace exercise classes, We have a capable home modification program that we have in partnership with Habitat for Humanity, Metro Maryland, and Hyattsville Aging in Place. We have home repair and weatherization services, free legal counseling, and estate planning seminars in partnership with the Pro Bono Resource Center of Maryland and Hyattsville Aging in Place. We have a Lunch and Learn lecture series. We offer Meals on Wheels in partnership with Meals on Wheels of College Park. We provide public benefits assistance and information and referrals. And through the pandemic, we've also provided free cell phones to community members in need who do not have either inadequate phones or they needed a backup phone. Our city's motto, which is I think very appropriate for being an age-friendly city, is a world within walking distance, which our city actually adopted before becoming an age-friendly city. So we actually are very proud of this motto. We actually began the process to become an age-friendly city in 2017. And this process was driven by our community residents. We have a very diverse and culturally rich community. And when I say culturally rich, we have about 30% of our population is comprised of African American, Black community members, 30% roughly Hispanic, Latino community members, 30% white, and then about 10% of other nationalities. And so for us, this makes partnerships especially important for outreach, to be able to provide services. Nearly 10% of our city's population is approximately 65 years or age or older, and at least 42% of them have at least one disability. So in many cases, some of them have more than one or two disabilities. So this is information that is important for us as a city as we think about how to identify and serve the needs of our community members. And I think like most older adults through all municipalities and counties, their desire is to be able to live as long as possible in their homes and communities of choice. And for Hyattsville, our process was in 2017 to identify what are the action steps we could take as a city to make it possible for older adults and persons with disabilities to continue to live in their homes in this community. And the action plan that was developed was adopted by our city council in 2019. And the action areas that we identified as priority areas for our city to create policies, programs, and services encompass housing, which includes affordable and accessible housing, home and community-based services, and that would include in-home care services, home and yard maintenance assistance, transportation services, health and safety, and that would include items such as emergency preparedness, falls prevention, food security, social inclusion, and then the other priority area would be communication and outreach. And this would encompass increasing awareness about available resources and activities, and then also expanding our outreach to diverse communities. I'd like to add that Hyattsville was the first city in Maryland to join the AARP network of age-friendly cities. And as a member of this national network, we've been so fortunate to befriend and to get to know and collaborate with many age-friendly allies, many of whom are on this call today. And it is so important in this work to have partners and to have allies because the need is so great and the opportunities just so expansive to be able to create change, but it's really difficult to do as one organization, one municipality. And so our partnerships really make this possible. I would say that especially with this past year and a half, having been challenged with COVID, we've learned all too well how new partnerships and leveraging existing partnerships has really enabled our city to be able to pivot and address the needs of our community members. We've formed new partnerships with the Capital Area Food Bank to be able to provide a weekly food distribution event at our park, which we've done for now over a year and a half. And we continue to do that. We're partnering with our county's Department of Aging, and we provide, in addition to Meals on Wheels, we're providing the county frozen meals that are delivered to our older adults who are not able to leave their homes to come to the food distribution event. We partner with Hyattsville Aging in Place, which provides a lot of social support to older community members and transportation to doctor's appointments and to the grocery. We partner, as I mentioned, with Habitat for Humanity, which has made it possible to make home modifications a reality for many people who otherwise would not be able to leave their homes if they needed an access ramp. So our partnership work is so integral to our ability to create change. And it's a pleasure to be here and to learn from others, and looking forward to any questions later. Thank you.
Great.
So,
And-
this is our region so far in the going around the Beltway, if you will, heading around Maryland. Prince George's County, as I say, is thinking about this at the county council level. So we'll see what comes out of that consideration. But we'll move from Maryland across the Potomac and have a conversation now with Helen King. I'm sorry, we're going to go through Alexandria and go north until we get to Arlington. So Helen.
Thank you, Gail. Good afternoon, everyone. My name is Helen King, and I serve currently as the director of the Arlington County Agency on Aging. Arlington joined the network of age-friendly communities in April of 2018, and we're always quite proud to say that we were the 250th age-friendly community in the United States. Age-friendly Arlington is a community-driven effort, and we are coordinated by an age-friendly task force that consists primarily of commissioners on our Commission on Aging and community leaders, as well as county staff. And this task force is looking really at enhancing the quality of life for older Arlingtonians by ensuring that the planning and county activities are addressing their specific needs. Annually, we host a community engagement forum to hear from our older adults and key stakeholders. We want to hear what matters most to them and their caregivers in our community. This is a wildly successful event every year. We adapted it to a virtual event this year because of the pandemic, and actually got more involvement than we've had when they've been in-person events. So we were really happy about that. We incorporate age-friendly goals and objectives in everything that we do. And, you know, specifically talking about our response to the pandemic, we did try and look at that through an age-friendly lens. Our intake process, for example, in our Aging and Disability Resource Center is now primarily phone-based instead of asking folks to come in. And again, we see that we're able to serve more adults this way than we ever have before. And it removes a lot of barriers, such as transportation to our offices, needing to wait in our waiting room, and other barriers that precluded people from coming and asking for assistance. Our Meals on Wheels delivery shifted from daily to once a week. We launched a friendly caller program to address the social connection component, because Meals on Wheels, we all know, is more than just the meal. And then we led an outreach effort to coordinate vaccine appointment scheduling for our older adults to ensure that it was inclusive and met the specific needs of our older adults. This was so successful, our efforts, that it actually was expanded to the entire community as the various age groups were opened up for the vaccine eligibility. We work closely with our housing and legal partners to prevent evictions for our older adults. And we ensure that homes are safe through the development of a universal design checklist and also referrals to community partners that offer home modifications to foster aging in place. So two of our recent age-friendly successes that I'd like to highlight. First is a connection of lower income older adults to fresh fruits and vegetables at some of our independent living buildings. And we did this through a partnership with Fresh Farm, which is one of our local farmers market managers. And what we created was pop-up markets at the independent living residences. So we held two this summer, one in July and one in August. And we're planning another one next week. And they've been really hugely successful. The residents of these independent living buildings love them because they can just walk out to their front of their building and the farmers market is there. And they've really enjoyed shopping for fresh peaches, tomatoes, green beans, melons, and so much more. I think at our last market, the peaches and the beets sold out so quickly that the residents who were maybe 10 minutes into the market were out of luck on those items. But we do have one more, possibly two planned for this market season. And then where Fresh Farm is also looking to expand this model even further in our community, because from their perspective, it's worked really well also. And then our second highlight is around transportation. Our transportation committee within our Commission on Aging has done a lot of research on pedestrian safety and accidents in our community. And they've learned that older adults are at the highest risk, both as drivers and as pedestrians. About 20% of critical crashes in our community involve senior drivers. And then regionally, the Metropolitan Washington Council of Government reports that for the time period of 2013 to 2017, drivers over 65 were involved in a higher per capita number of crashes in the metro area. The number of people over 65 who were killed while walking is up 95% over 2018. And so our transportation committee is really looking at ways to develop and support programs that will make it safer for our older residents, and especially those that want to walk. And so they're looking at solutions such as lowering and enforcing speed limits, signage improvements, improving lighting, encouraging walking, and improving also the physical condition of our older adults through balance programs and things like that. Recently, our transportation committee submitted a proposal to AARP to furnish and incorporate see-me flags at several crosswalks. We were awarded a grant for that, and just this past Saturday, they installed the see-me flags at several intersections in our community. So if those of you that don't know what the see-me flags are, they're a little orange flag that are in buckets at either side of the crosswalk, and so you can pick up a flag and wave it as you're walking across the crosswalk so that you can be seen by drivers that are potentially approaching. And so like Marcia in Montgomery County, Arlington considers ourselves already age-friendly, but we know that there is much more we can do to ensure that we continue to be age-friendly and inclusive for residents of all ages and stages for the years to come. So thank you for this time, and I look forward to answering any questions.
Thank you, Helen. Your presentation just causes me to be jealous, as I am of a number of the initiatives. Our Vision Zero program, which is similar to yours in DC, our Vision Zero program has slipped. We are hurting more people in the COVID period because people are speeding in the streets. And we are finding that is a real problem that hopefully we can address. But I really like the See Me program idea, and I haven't heard it from anyone in DC. So we're going to be very interested in that. When we heard from Marcia Pruzan about Montgomery County, home sharing has been of great importance to age-friendly DC for some time. because of the fact that we see the income that comes to those who can't make ends meet from home sharing as a really important aspect of why having someone living in the same house with you, if you have a spare bedroom, and DC has lots of spare bedrooms, we really want that program to take off and to be a successful one in Montgomery County, because then we can point and say, see, they're doing it in Montgomery County, and then we can probably get a little more attention to getting this program moving in DC. Marcy, when she was talking about the situation with regard to fresh food availability, reminded me that there are probably many on this program who are involved with programs with older adults that could take advantage of this. And there are programs in this region that would welcome the opportunity to partner with that. And talking with Marcy about that would be good. We can certainly connect you as well. In DC, we've been involved in the age-friendly activity since 2013, when the then on the council, mayor of DC, pushed it because she thought it would be a great idea to see DC work on its various directions that it could improve to be an easier place in which to grow older. That has now we've been through our first 5-year plan, as by the way has Montgomery County. We're on our second 5-year plan and showing progress. And I would say that where we haven't yet talked, and earlier I noted in the chat that we have Helpful Villages, Manuel Acevedo, who is a Helpful Village, has 11 of the 13, are you ready, 13 villages in the District of Columbia using their app, and they can assemble data about what is going on with regard to people who are village members. And there are more village members in DC than there are people coming to wellness centers. So, and if we look at the general region, we have more than 75 villages in the area. Any of you who are not connected in some way or another with the village activities are missing an opportunity to work with older adults who may very well find themselves in a position where they're looking for housing other than the house that they started in. As Marcy points out, making changes to housing is a really important issue. It's one that we have addressed in DC with Safe at Home, our program that has been very much involved in making changes that enable people to get in and out of their homes, as well as to use their bathrooms and kitchens safely. So there are grants available that slide depending upon the income of the person. But that program has moved on so long now that we're interested in seeing the data resulting from that turn into what it relates to in terms of falls. How are we doing with falls? So I would say that you're seeing a picture of a very important activity that brings together, as all of our speakers have pointed out, the community organizations as well as the government working together to make change that can affect the lives of people who are pushing carriages, or and then that's how old that person is, but still growing older, but all the way to those who are, and I will tell you, every one of our jurisdictions has more centenarians now than when Age Friendly began in 2013. So with that, I think we should stop and give you an opportunity to ask maybe some questions that have occurred to you. So Steve, you're the master of ceremonies. You are the one who can help people to express their thoughts.
Well, first off, Louis Tenenbaum, who many of you know is a Universal Design Pioneer says home mods efficacy data is a critical need. Congrats to that wonderful and progressive program, and couldn't agree more. And a couple of questions / comments that I'm just going to drop into chat. One is really, I agree that that pop-up farmers market program is one that we should be replicating nationwide. That is amazing. And the audience agrees as well. And let's see, there's a question about the picture in, I believe, in that Hyattsville slide deck. So maybe if somebody could just comment on that in chat. But let's see, if anybody has any specific questions, if you'd like to raise your hand or type them in, we can address those as we wrap. Oh, this, I really like this one. Ravi Bala says, here's a framework to consider: Capable, Silvernest, Papa Pals, Uber Eats, Encore, Silvernest, Alexa together. Ravi, you are definitely out there looking at some of the pioneering aging at home technology companies. That's pretty cool. Bob Hoffman asks, can somebody outline the goals of the AARP Challenge Grant?
That would be Melissa if she's still with us.
I'm here. Yes, so the goals of the Age-Friendly Social Innovation Challenge are to generate these moonshot ideas for each of, we have 9 domains, and then also building a repository of all of the age-friendly partners that we have in the region. So anyone that registers and has attended that event or came to the Ecosystem Summit, we consider them to be our partners in this regional movement. And then what AARP is wanting to do is to explore the possibility that this could be a national model. The Age-Friendly Cities and Communities Initiative, was started, several years ago, and most of the cities tend to work in silos. And this is the first time that a region has been brought together to share these ideas and then brainstorm for actionable items. And so hopefully it will be replicated, and we're just going to be leading the charge.
Great. And Thomas Massey says, I live in Old Town Alexandria. How can I get involved to promote the Aging Well community efforts? Isn't that, we just don't have them on the call right now, but Alexandria does have Age Friendly, correct?
That's
yes,
right.
And they're part of our regional efforts. So we can connect you, Thomas. So I'll put my email address in here. And if you want to email me, I can get you connected to Jane.
Okay.
Hey,
yeah, go ahead, Marcy.
I'd like to respond to the comment about the artwork that was featured in one of our slides. The artwork was created by community members who participate in the creative aging class that's offered through a partnership our city has with Artworks Now. And this is a beloved program that our city has with a nonprofit that promotes access to art to all community members across all ages, with a really keen emphasis on equity. And one of the things that is really wonderful about this program, and I think other arts programming, is that prior to COVID, our community members would go to Artworks Now, to the site, to create artwork and to be with each other. Many of them had never painted before. And many of them thought there was no way they would be able to learn to paint. And these individuals you see in this picture, this was from a few years ago, are just, it's so inspiring, because I think it shows just the value of lifelong learning, being able to create opportunities for social inclusion and participation. During COVID, this was such a valuable and beloved program by our community members. Artworks now made the program available online, and then community partners provided art supplies gift boxes so that residents did not need to go to Target or out to an art supply store. And so they've been able to continue that. But I think it's just a great example of, through partnerships, what we're able to do, but also highlighting the importance of artwork and togetherness as being one way to also promote social participation and inclusion.
Great. Deb Merrimer has a relative moving to Pittsburgh in the near future. How strong of his interest is in this area, and how do, like, if you're in a region that doesn't have this, what are sort of the first steps that somebody might take? Whoops.
I think you're on mute.
Leadership. I'm trying to speak. I'm sorry. Needs political leadership. The mayor has to speak, and the mayor has to write a letter now to AARP. It used to be that everyone had to write to the World Health Organization, send their letter that direction. Of course, we're all doing this virtually at this point. But sending a letter to AARP and indicating an interest in being part of Age Friendly is the start point. That gets the political side of that is the government moving along with everyone else. And that is a really important part of what the jurisdiction has to do. But then it's about building community engagement and getting people to express their views and concerns about the community and how it can change in accordance with a framework that is what started with the World Health Organization, is now promoted by AARP. So looking at either place and mentioning AARP Age Friendly, that is, go to WHO or go to AARP, and you can find what they suggest are the areas in which to focus. For those of you who are familiar, I know you'll know what I'm talking about when I say social determinants of health are the backbone of what it is that we are doing with Age Friendly.
Great. And then Carolyn Pennington is on the call, and she's from the Shepherd Centers in Northern Virginia. And she was sort of mentioning that they've got, free transportation and services. But for all the providers that are in the audience, what's the best way for a provider, whether it be a nonprofit, for-profit, to get involved? And are sometimes I could see where providers could be the catalyst to creating an age-friendly city or community. The benefits would be huge.
And I couldn't agree with you more. That's right, Steve. We really do need the providers to step forward and be interested in what's going on, because they can benefit. People mostly want to stay in their own homes, but then things happen. Age of apprehension happens. People find they don't want to have family members be as caregiver focused as they have to be in order to take care of frailties. So there's a role, an important role, for providers who are providing long-term care, housing, and services to individuals. Villages and all the others, including, I would say, Shepherd Centers have been around longer than villages, but they're doing the same kind of work.
Great. Holy cow. I just glanced at the clock, and it looks like we're almost to 1 o'clock. Let me just do a quick scan to make sure that there's not any last straggling questions in there. I really want to thank all of you for taking the time to share with us about this movement. And I'm really excited to see the directions that it goes. And maybe we can make this gathering a biannual or regular event to get updates on the age-friendly movement in this region and nationwide. And this is being recorded. I will post that recording. The chat will be recorded, minus our little friend who somehow jumped in with us. And I'll make sure to share the PowerPoints that everybody in the audience had as well at that link. And I really want to thank you all for your time today.
Thank you for
Thank you,
inviting us.
Steve.
Thank you.
All right,
Thanks
see
for
you all
having us.
soon.
Thanks so much.
Bye-bye.